For healthcare staff working in acute, community, care home and residential settings, dealing with blood and body fluid spillages can be a regular and challenging occurrence. Body fluids, including blood, faeces, vomit and sputum, are considered to be potential sources for blood-borne viruses, for example hepatitis B or other microorganisms. It is therefore vital that all spillages of blood and body fluids are cleaned up as soon as possible, and contaminated surfaces are disinfected immediately. There are 5 steps necessary to successfully manage a spillage. Step 1. Cordon the spillage off. Step 2. Assess the type of spillage. The algorithm will help you here. Step 3. Collect the correct equipment. Step 4. Protect yourself. Step 5. Disinfect and clean. Following these steps ensures no harm comes to those we care for, other staff, visitors and ourselves.